All right, good day everyone. So this is a continuation of Module 10, Chapter 45, Medication Management. So let's just identify medications. Medications are drugs and substances used to prevent or treat illness, right? So just giving you a heads up before we learn further with medication management. Not all facilities or technically PSWs are not uh, allowed to give medications. There might be some facilities that they allow you guys, but you need to undergo certain training delegations from the nurse or from other professional individuals, right? So basically, medication management, you're only given allowed to give oral medication. However, that will always depend on the company policy. Okay, that's why medication administration or management is included in our lecture. So again, clients may self-manage medication or require assistance. So mostly in a community care setting, you will just hand over the medication to the client and then remind them that it's their time to take their medication. So that's basically how PSW should assist in terms of oral medication. Support workers assist only with their defined scope of practice. All right. So you're not allowed to give in IV medication, injections, etc., or anything that you need to insert to the client's body. Okay, so usually management happens only in a community-based setting, wherein the medications are already packed in a blister pack and there's time in it, and then you will just hand it over to the client and then remind them that it's time to give or to take their medication. So the scope of practice, it's reminding and assisting clients to take medications. That's what I just mentioned earlier. And then checking the labels against the MAR and care plan, making sure it's the correct medications that they're taking, correct dose and correct client. And then you will just observe and report any changes after the intake, and you are not the right person to evaluate the effectiveness of the medication. Basically, if you will just consider there might be a little bit of like dizziness, you will just inform and report and document it that after the medication, client took the medication, and then after 30 minutes or an hour the client felt dizzy, right? So something like that, but you will not confirm if the medication is effective or not. So the 10 rights of medication management, this is very important to remember, guys, because as we give our medication or as we assist clients in terms of medication management, you should remember that it should always be the right medication. Double checking the MAR, double checking the care plan, and double checking the client's name by asking them, can you state your name, please? Or in the client's home, you know that it's the client, just double check the MAR, or if there's a binder for the client or even the blister pack, that it's the correct medication. Of course, correct person by asking the client, can you just repeat your name and then correct dose, right? So you will always double check in the MAR or in the care plan or even whatever documentations that you have in your workplace. And then making sure it's a correct route. If it's oral, it should always be oral. You don't put it, you don't put it under the it's not suppository, right? So if it's oral, it should always be oral. And of course, the right timing, right education, right day, right reason, and right expiry date and right documentation. So make sure you document after assisting the client, making sure it's correct date, it's not expired, making sure it's correct reason why the client is taking such medication, and of course to educate the client, right? Like, Mr. Smith, I'm giving you this medication because this is for your pain, right? So that's a simple of education. So client always have the right to refuse if they don't want to take their medication on that specific day. However, as what I mentioned, you can encourage them 3 times before you really document that the client refused the medication, right? So it's always good, like, encourage them 3 times in like 10-minute interval if you have longer time to stay with the client. And then if they really don't want it, then you can document. Uh, Client encouraged to take the medication, scheduled medication 3 times. However, client still refused, right? So you can actually document that way. So documentation and error reporting, or It could be also like a medication error reporting or IR, depends. It should always be like all assisted medication must be documented in the MAR. If the medication is given, there should always be a MAR or a form. MAR means medication administration record. That's what MAR means. Okay, it should always be written there. There are some like guides on the side of the MAR, like if it's one, medication given, two, medication refused, blah blah blah. It depends, right? So you will learn that if you will really take or you will really give medication in your workplace. So again, there should always be a proper training before you do it on your own. And then medication errors must always be reported to your supervisor. If there's like a wrong medication or a wrong timing, it should always be reported to your nurse supervisor. Okay, because failure to report may lead to serious consequences. There might be like some arrest or something like that, or maybe double dosing, etc. We don't know, right? So it's always good, even if you know that you might be addressed with consequences, but at least you have reported it, okay, so that it will not add further issues. Okay, so that's basically it in terms of medication administration. Always remember to follow the 10 rights of medication, double checking. And I don't want you to worry so much with this one because we will learn this when we will do our performance demo, how to assist clients in medication. However, not all employers allow PSW to give medication, okay? So that will always depends in your employer still. If you want to learn further with medication management, you can always check your Elsevier in terms of further details. All right, so that's it for today. That ends our module 10. So see you in module 11.